I started using the tongue retainer maybe in April, and I think that really turned things around for me. It added a little bit of wiggle room, I guess, more windows of lack of suffering. So, as stupid as it is, and as uncomfortable and hurting my teeth and under my tongue and my jaw, I guess it's worth it.
So, last night was horrible. I just woke up at 3 a.m. and couldn't go back to sleep. I sat in a bath for like 2 hours, ate breakfast at 5 a.m., went back to sleep at 7 to 10. But yeah, big migraine today. Getting closer to the surgery date. I think it's June 11th. And getting more nervous about it, getting anxious. Had a nightmare about just looking disfigured, and I don't know exactly what it was like, just what I looked like, just kind of feeling ostracized and scared. And I thought maybe it was because maybe I was just being too aggressive with the goals of therapy, communicating them to the surgeon. With the aggressive focus on advancement, the jaw for as big a effect as possible to cure it. But maybe I was just disconnected or underplaying the importance of appearance. So I might have to, just amend that, like the 50, 30, 20, 20% on appearance weight on my goals, maybe to more like 40, 30, 30 on effectiveness, functionality, cure. I'm not sure yet. Might just be fear that it's coming from, and something to work through. Appearance is important. I had that presentation last week, and people can be just so critical, make instantaneous judgments, narratives based on their understanding when it's not accurate. So there's already a big barrier to surmount. The clouds are nice. It's quite nice today. I hear it's storming up north today, thunder and lightning. I passed the presentation that I was worried about, but I almost feel like not happy about it. Very the perfectionist criticalness comes up, and lots of shame parts. Like, I have to do a self-assessment, and I'm like, I could have done so much better. I'm just completely like brain dead. Like, I missed this. It's not good enough. I almost expect it to fail, and I'm almost like I was saying I was going to be a social worker, but that's probably just a joke. I don't think I would have done that. I would have probably just tried again, and maybe with the functioning brain, I would have done what I considered good enough. And some of the other assessors' feedback were also like, I'm like, what? You didn't even listen. they just didn't get it. They just didn't hear me. Their comments were so off mark. Like, what the heck? Where is this coming from? Just personal preference or just misunderstanding. It's just very frustrating. And I got like an even 70 when I needed to pass, and it's just like so unlikely that it would get like even 70 that I feel like they're just like, oh, he's close enough, you can just pass, like I'm being pitied or something. I don't know. Yeah, like, so all these little voices, narratives, barriers coming up to not let me just be happy that I passed. I don't have to take this friggin' course again next summer. It's hard to feel the gratitude, the joy sometimes, you know. It's a great day, it's sunny, it's warm outside, I'm walking. Why can't that be good enough? Central to my spiritual beliefs is the adage that we might not always get what we want, but we always get what we need, kind of thing. So that's a bitter pill to swallow. Don't really want to get half my face cut off, but I need to. And life has shown me that my experiences, the narrative that I've constructed, it's brought me to this point. I wasn't ready to do it when I was 14 or 15. It's too overwhelming, too scary. Didn't have the support I needed to make that decision then, the emotional capacity. So there's a quote, keep on breaking your heart until it opens. And suffered enough. And I'm stepping into the unknown, trusting, having faith, things will work out. Opening my heart, letting this guy cut off half my face, stick it back on with metal. It was my destiny. And if I didn't have that faith, that open-heartedness, that looking for meaning everywhere in the mundane, day-to-day, creating stories everywhere through my experience, I wouldn't have ended up here. I wouldn't be moving forward with this. I don't know where I'd be. I'd be in a horrible place. I wouldn't be myself. Today might be so bad because I ran out of allergy pills and Claritin a couple days ago, and the little white dandruff thingies outside flying around have been pretty bad lately, and I've been sneezing all over the place, so that might have part of it. I can't really think of any other reason, so that's probably it. I bought some more, so we'll see how that goes tonight. It's June 16th, and I saw an immunologist specialist today, clinical immunologist,
and he poked my arm with a bunch of different stuff, and found out that I'm very reactive to grass, very big reaction to grass, and a little bit to trees also. And we talked a little bit about like subcutaneous versus like sublingual immunotherapy, and like I just more questions were raised for this, but it's not something that's gonna be like, it's like a long-term thing. Like for the subcutaneous, I have to go in every week for months, and then it's gonna continue for years, like 5 years, and like yeah, only like 30% after those 5 years are cured or whatever. So I have to really look into the immunotherapy more, to reduce the nasal resistance, at least for those inflamed turbinates.
So about about a year after I started using the CPAP, um, there was notice of a recall, and I'd been informed just randomly at a follow-up appointment. They said, "Oh yeah, we sent out a message a while ago saying that your machine was recalled due to hazardous particulate degradation, um, causing that can cause lung damage or cancer, and little black particles from like a type of resin they use around the motor to make it more quiet or something." And I'm like, "Oh, that's great, I've only just been using it a year." And apparently it was lots of different machines. It was a very systemic thing. Anything from like this one company, it was like they're all junk. They recalled it all, and there was a big shortage of these machines. Everyone was scrambling to replace them. It wasn't being, the company said they're working on replacing it eventually. Like, we can live without these machines at all. It's still ongoing. Like, they haven't replaced them yet, so I had to go buy this other machine out of pocket. It's been a year, so it was just a really negative experience. Um, Really horrible. And yeah, the third party insurance only covers one every 5 years. I was lucky enough to find a different com- just like a store that had a machine left. I bought this one for 1,200. It's ResMed for her, so it's got some pretty flowers on it, which is awesome. I love that. Look at the pretty flowers. I want that thing pumping air into me, definitely. Um, but yeah, I'll be glad if I can like throw it out or sell it on eBay if people do that. If this surgery actually works, I'm so done with it. And I mean, it's only a couple weeks until my surgery, and I still don't know exactly how effective CPAPs are, like in the literature. I haven't read much of the studies for CPAPs, because I guess it's just like, it's the gold standard therapy. It's what they start, what everyone starts with, I guess. And like I read somewhere in the literature that it's just like, yeah, it treats the sleep apnea. It's like a mechanical stent for the airways. The positive pressure pushes everything open, and that's it. It's good. Um, but I guess I mean, there's like, you can't like put like what's it called, a pressure cutter, pressure, like a leaf blower. You can't like put so much pressure. It's like a leaf blower up your nose, without like having consequences. It's there's like the maximum tolerable pressure, I guess. And I was getting so many at first, if I couldn't go to like a therapeutic pressure. And if my airways are narrow enough, it's like, especially with the hard tissue, like it's not gonna really do anything. So there's significant limitations there. I did do, like, for the journal club, I presented the Isaac study, and it's like, it's looking at cardiovascular risk, so it's not really focused on the cognitive effects of OSA, neuropsychiatric cognitive blah 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 effects. I think the CPAP did help me with energy and cognition and mood, and yeah, it helped a lot, but just partially. And it wasn't an immediate effect. It's very subtle, I guess, longitudinally over time. You can see like, oh, I'm able to do more art now. I hit a bench press PR for the first time in my life, or first time in like maybe years. Those are quantifiable things that have happened. I painted pretty pictures, posted them on Instagram, did 2-plate bench, like this happened, and it happened only after I started the CPAP. I don't know. We'll see what I can do after the jaw surgery, and like compare the capacity after the jaw surgery, the achievements like my functionality, the things I'll be able to achieve versus how things are now, very limited in everything. Yeah, I guess I don't know. Maybe I should have looked into the studies for the CPAP more, but I wasn't into considering alternative therapies though. So, anyways, learning experience, but maybe I'll look into it one day. Just skim those systematic reviews. Look at the effect size, what they're looking at, sleepiness, functionality. If they can actually have a measurable effect. What's the measure on the AHI change? So it's June 14th, I believe, and yeah, horrible sleep again. Woke up 2 or 3, went to bed at like 10, and just couldn't go back to sleep. I took another bath at 3 a.m. and ate breakfast at 5 again, and went back to sleep I think around 6 or 7, and woke up at like 9. Went for a little walk. I'm about to go see the 4th oral surgeon, and this one was I went to see an orthodontist to consult with them, the same one my siblings went to that does the palatal expansion. They said they don't really do any like jaw surgery kind of thing. They're not specialized with that. It's not their practice. So they referred me to a different orthodontist who I went to see. They did some 3D scans kind of thing, scan of my teeth, and they referred me to this guy because this guy is the one they work with. But yeah, he wasn't able to get me in on a cancellation for the initial consult, so it was like months for the initial consult, and I think he has like a 2-year wait list for surgery. So it's very not likely that I'll be going with him. But I think I'll just listen to what he says. Like this guy, I don't think I'll mention that I'm getting a surgery in like 2 weeks. I'll just let him, I don't know, go in with like a clean slate with no bias or just like closed offness. Like, oh, like I'll just see what he has to say, as though like he was moving forward with me. And then on the referral the orthodontist sent to this dentist, he was querying about transverse widening, whereas the previous dentist said that's not really an option for me because I had the premolars taken out and everything moved back, and my occlusion, my finish was very good. I had most dentists usually say I have really good teeth alignment, although it's probably messed up now after the tongue retaining device.
So let's see what he has to say, especially about the transverse widening, the price, how he does the surgery, what recovery is like, whether to do the chin or not, anything about clockwise rotation, counterclockwise rotation. I want to know how he plans the surgery. If he's just like an analog guy, he just goes by feel like an artist, you know, or if he's all like 3D modeling, planning everything out step by step. I heard something saying like jaw surgery is more like it's like an art, by like I guess I can kind of relate to that. Like when I paint, you know, like I can't control everything. I have a plan, an idea in my head. Sometimes it works, sometimes it goes horribly, but hopefully, it seems like it doesn't often go horribly. This jaw surgery, it's pretty straightforward, I guess. So it's right after I saw the fourth oral surgeon, and my mind is kind of blown with how competent he was, and just his way of explaining things and listening, and just being kind of like kind and respectful and informative. I just really liked just how he explained things. He showed me how he plans the treatments and how he measures different angles. He showed me kind of like a scan, and like where he puts the plates, and kind of how far he advances, where he measures it, how like all the different angles he kind of uses, straight on and then sideways, how he advances the jaw. He also doesn't he rarely goes over a centimeter, usually like 0.8 to 0.9, and he often doesn't do the chin. But yeah, he has a 2-year wait time, and his price is also in similar to the first oral surgeon that I saw, which is about like 1.5 times my car's price, whereas the second oral surgeon I saw is about maybe 3/4 or something, or 2/3 of my car's price. So yeah, I feel like, I don't know, like maybe I'm just kind of excited, or I'm just very impressed in the moment. He works closely with an orthodontist. He has a very established procedure kind of thing, and yeah, I just had good vibes about this guy. But he has like 17 years of practice. He does one of these surgeries a week, he said. Yeah, I feel like if the situation was different, if he didn't have a 2-year wait list, I might move forward with him. But in any case, I'm probably gonna leave a good review on his Google page or whatever. But like, I've already been off work for a few months at this point. Like the second oral surgeon was able to get me operation date in 2 weeks. Thank God. I just I can't like, waiting 2 years is just not feasible for me. I've been off work already. My brain's dead. So it was a good experience. He said doing the chin is very straightforward, very simple, like 20 minutes. He seems to do a lot more planning. I don't know about the surgeon I'm going with, how much planning he does. He seems like much more analog guy is the word that my uncle used, rather than digital guy. Whereas this surgeon, he really goes, like, he measures like different parts of the jaw. It really it makes a 3D model. And my surgeon never really discussed that. He never showed me his process that much, which is kind of, I'd feel better to know like exactly how he was planning it and what he was doing, kind of thing. It'd make me feel better. I'm nervous. And yeah, he said that my chin is already kind of like, I already have like a little bit of a chin, so he wouldn't necessarily do it with me. And like if I wanted to do it in the future, like it wouldn't be that much more difficult. So I don't know if I want to do the chin or not. It's making me think about it more. If my AHI is in 0, maybe it's something I can look into the future, or less than 5 at least.
Hey, it's June 17th, not 27th. That would have been the day of June 17th, so 10 days. Yeah, sleep's been horrible like usual. I'm at a little pond near my house where there's lots of ducks. I like the place. It's on my normal walk route. I wanted to talk about the weight gain. I'm not the heaviest I've ever been, but there was significant weight gain over the last year or so. And why is that? Well, I mean, I've never been able to go over 180 pounds even when I was trying to bulk, and this was largely unintentional. So I think there's one part that's just getting older. Maybe metabolism slower, easier to put on weight as I age. Another is the CPAP use. I think for whatever reason, CPAP's associated with a little bit of weight gain sometimes in the trials, and they're not entirely sure why, although there's some theories like water retention, increased lean body mass or whatever. Another one is just quitting the pornography. I know that when people quit smoking, that's associated with a decent weight gain, and it's just kind of like switching coping mechanisms, switching comforting, soothing behavior. And I've been doing a lot of comfort eating, granola bars, a lot of that. And the heaviest I went up to 205. I think baseline has been 180, and I'm about 193 now on a good day. And it's just finding it impossible to cut down, and it's just very difficult. And that just kind of fed into the OSA, so it's never been more apparent the severity of this condition now. So yeah, it makes me highly motivated to treat it.
Hey, it's June 12th, and I'm just feeling symptoms today, just very low functionality. I didn't sleep horribly last night, but I went for a walk. I wanted to go to the gym, but I just felt too awful. So I went to the grocery store and I came home and I'm just lying in bed. And that's the day. And it's feeling like it's not good enough right now. I want to do more. I want to go to the gym. I want to go visit my parents' house. I want to do so much, but the entire day is just wasting by. It's like only 1 p.m. and I just have to waste like another 7-8 hours before I can sleep, and it's still another couple weeks until the surgery. The waiting is difficult. I don't know if it's the hardest part. I don't know what the hardest part is. The entire experience, I guess, and the years leading up to this point, all of it was the hardest part. I just want it to be done already and for things to get better. There's one character from one of my favorite fantasy novel series, um, The Stormlight Archives by Brandon Sanderson. The character, he's like a king or something, and he's got a curse. Every day he wakes up with a different level of intelligence or competency. I forget the details about where the curse came from or like what his official position was. He's like the head of state or something, and yeah, it like just kind of follows a normal distribution a little bit. So usually he's like of average intelligence. Sometimes he's just a complete like nincompoop is the word that came to my head. He's a nincompoop. He can barely like feed himself. He's barely continent. He's just a complete invalid. Um, Whereas other times, he's a complete genius. He's like a prodigy. He's I don't know, paragon of anything he does. He's just spectacular, making connections, deep insight, wisdom. And every once in a while, there's significant outliers, you know? And the plot revolves around one day years ago where he had such a positive outlier. He was such a genius that he almost seemed like an invalid kind of thing. He started like writing on the walls of his room with like his own body matter, body fluids or whatever. And like his attendants were just like, oh, he's having a bad day. But then they realized, no, he's having a good day, a really, really good day. And like he basically just prophesied the future on that good day, and that they're just still following the path that he had set out on that good day. Later on, when he like, and he's never had a good day like that ever again, because it was such a positive outlier. I wonder, like if he had like a negative outlier, that's significant. He'd probably die or something. But yeah, like I felt very connected with that kind of narrative, that story. Like it kind of feels like a lottery almost, whether I have a good day or a bad day, you know, whether I'm functional, whether I can think, I can do things, or I'm a complete like invalid. I'm just sitting in front of a screen all day, just barely able to do anything for myself. Yeah. There's been, I guess, a gradual shift towards less functionality over the years. And that brings us to here, have my face cut off. But it's a good, I just felt connected to that story, and it's just a very powerful symbol, a very powerful narrative to kind of connect with and understand my situation better. It's June 18th, and the last few days have been horrible with the sleep. Um, this is my third bath today. The first one was at 1 a.m., the second was at 8 a.m., and now it's 5 p.m. I wonder if I can take another one before going to bed again. I already mentioned I was getting more scared moving towards the surgery, and the nightmare about looking disfigured, and just having hesitancy with the goals of therapy I described to the surgeon, being aggressive with the advancement, and wondering if I should correct or change that to be more conservative overall. Also prioritizing aesthetics, appearance. But when things are this bad again, I'm like, hell no. Move this as far forward as possible. And I don't know. Uh, on one hand, I'm driven by desperation, and on the other hand, I'm driven by fear. Desperate to get the cure and effectiveness, move it as far forward, but scared of having too much of looking disfigured. I just read again on one of the meta-analyses for the MMA how increased maxillary advancement increases the risk of increases the success and cure rate. Like every 1 millimeter more forward has increases the odds of a success or a cure by 2 or something. So I'm just going back and forth, and that's okay. That's okay. Ambivalating is okay, and sometimes it takes a while to make a decision or consider all the different parts to find which way is best. But right now I'm kind of polarized to the aggressive advancement, because this is pretty bad. So with the nasal procedure, someone was just like, you could get a nose job or you could get a boob job, what's your priority here? For the tongue procedure, the tongue base reduction, I figured I'd be like the Grinch's weird cousin, because I think it reduces the tongue volume by roughly 17%, as opposed to my heart growing by a factor of 3. Yeah, for the tracheostomy, I figured that I don't need any additional orifices for life to force non-consensual intercourse on me. So that was ruled out. The uvula, I feel performs a very important role in being able to gag when things are gross in life. Ugh. It's very important. So yeah, what am I left with, right? I'm just move everything forward a little bit. You're preserving everything, just a little bit of metal. Some technological upgrades. Just based on my family history, the medical history, it seems like OSA is quite prevalent in my family. On my father's side, his mom had Alzheimer's, and his dad had Parkinson's, so neurological disorders. And my mom's side, there's cardiometabolic stuff. My mom's dad had a number of heart attacks, and my mom's mom has just a number of cardiovascular and diabetes type of stuff. And all of that stuff, neurological, cardio, is really strong, or it's associated with the OSA. So I'm just it'll be interesting to see how it'll affect me getting this treatment going forward longitudinally. And one of like my dad's like one of my last names, it's hyphenated. One of them's for my dad, and Antepian. So the Greek or Roman root words, anti means before, pi or pyre means fever, pus, fire, and en means of or related to. So of or related to the time before, fire, infection, fever, yeah. It's like I interpret it to be related to the time before illness, back when we were healthy. So I'm wondering, like, what must have happened? What type of symptoms must have my ancestors have happened to have been named that, you know? Like, I'm not even 30 yet, and my cholesterol's high. I started on a medication, and that's quite ridiculous because I exercise, and I don't eat horrible, and yeah. And I remember reading a study about the CPAP machine saying it doesn't have an effect on the metabolic syndrome, whereas this jaw surgery, people lose some weight on it.
Something I forgot to mention is just the everyday kind of impact, demonstrating the cognitive memory deficits, you know. Sometimes I'd be like sitting on the couch, and then I'd get up and go do something, and I'd stand there, I'd be like, what was I just gonna do? And other times, I was gonna say something, and then I forgot. I was gonna say like 3 things, and then I forgot, and I have to think. Sometimes I can remember, you know, forgetting names right after they're said. Literally, it just doesn't, I just can't hold them in my head. Oh my gosh, cooking is just like a nightmare. I have like a 50% burn rate on like rice. My roommates know to stay away from me if I try to cook anything, because I just go like, I'm just like all over the place, and then like I'll forget something, and then I'll come back and it's like burnt, and I'll be like, oh shit. Or I'll turn on the wrong part of the stove, or I'll just forget it on after, and it's just like, oh god damn, I'll just burn the house down. I really don't, it's bad. And of course, with the studying and the memorizing, that's difficult. I think for a lot of my work, it's almost like learning a language. I think like I have the language mostly entrenched. Like I can speak fine. Like I have a lot of the knowledge already entrenched, but the learning, the focus is difficult to retain stuff. Like I think there's like 4 quadrants of learning. You know what you know. You don't know what you know. You know what you don't know. You don't know what you don't know. I think like it's going. It's hard to go in the right direction. It's knowing what I know. Like I feel like it's going to. I don't know what I know. It's almost because it's subconscious, and that sucks. I have faith it'll come back fast though, and I love studying, so it shouldn't be that hard if I have the energy.
So it's June 23rd. 4 days. 3 days. I was at the library reading some more today, and just watching videos of the procedure. It's kind of scary. I guess that was unsettling, but I somehow stumbled upon some information or some articles about, I think I might have searched it up, like I was wondering if the epiglottis can cause the obstruction, because most of what I read was like nasally, palatally, lingually, retrolingually. I didn't know anything about like sublingually, like like laryngeal, into the laryngeal area, like. And I was curious about this because I've kind of noticed right when I'm about to fall asleep, like I noticed like this tap sound, like right in the base of my tongue area, kind of thing, like little, like it's collapsing, or something like that. Like there's like a tap. Some of it feels like a squelching feeling. So that's just, just making me even more stressed and anxious. Like there's the fear of what I don't know, and how it's gonna get me, gonna screw everything up. Like does the double jaw advancement, like will that have an effect on if the epiglottis is collapsing, if I have a very like long or uh like extended epiglottis. So I was reading this one article that says it could be like a contributor in 10 to 40% of cases. It's not very well researched. It's not very apparent, and it could be worsened by the CPAP because the air is kind of blowing like the flap open, and if like there's a very like, I don't know, like a very deep or very big base of the tongue or something like that, like it can cause the epiglottis to more like collapse that way. Like and my, like, yeah, I have a big tongue, so I'm ready for the surgery. The last few days, it's like the final stretch a little bit. These last few days, it's just getting worse. Like it's waking up at 3 a.m. and taking a bath for a couple hours, and then eating breakfast at 5 a.m. and then trying to go back to sleep. It's like a routine now. It's every night. Like I have a phone call with some friends, like every once in a while, and I'm like so out of it. I'm just like, I'm surviving. I'm doing okay. And then, like sometimes I'll be in the bath when I'm on the call with them, and I'm like, I'm going to sleep in a couple hours, but I know I'm gonna wake up after, or I'm gonna sleep right after this, and I'm gonna wake up in a couple hours, and I'll be right back here in the bath, and I am. So, like, I really hope tonight doesn't suck. Uh, Hey, it's June 24th. It's the Friday before the surgery, and I just got off the phone with the anesthesiologist. I missed their first call because I was asleep, and luckily they called back and just asked some questions and told me about what the
at what things are gonna be like. They put a tube in one of my nose. They want to see if there's one nostril I can't breathe out of, and it goes down my vocal cords. Usually they take it out when I wake up, or maybe not. And I'm talking about pain medication, stuff like that. If I have any heartburn, how bad my OSA symptoms are. If I've ever had it before. I don't think I have. I had wisdom teeth taken out once, but that's it. So this is kind of like last profile. My teeth kind of moved with the tongue retainer device. I'll probably need braces after. I don't know if you can notice, but I noticed, and it's uncomfortable. So on the side, you can see that there's some anterior head position, very significant, neck hyperextension. I think I read an article that it was associated with OSA disease severity. Like if I stand up straight with a good posture, like you can notice a little bit recessed jaw. I can't breathe. I stick my jaw out. So airways completely occluded when I stand up straight. And I have a banana here. I'm gonna eat. I don't know why. I thought it would be funny to have a video of, hey, this is me eating a banana before my surgery versus me eating a banana after my surgery. Bananas are good. We love bananas in this house. I'm curious what the surgery will be able to do to my posture. I'll be able to stand like this afterwards. This is Bob. I tried to buy a real human skull online, but all the websites were sold out. He's got a little bit of an underbite, but I guess, yeah, it's synthetic. I got this from Amazon for $30. My mom was pissed for me wasting my money, but it was only $30. And, you know, there's the artistic value. You know, I think I'm gonna try to cut through the mandible and the maxilla here and just move everything forward and staple things back on afterwards, you know, just as a creative pursuit. His name's Bob, and I was thinking of getting him a wife, you know, Bobina, but my mom is like, no, you're done. So he lives on my plant shelf next to my Buddha statues right now. I think I was gonna drill some holes into his skull, give him a trepanation just for good measure. And I also got this giant oral syringe, like 300 mils. I was watching YouTube videos saying that it was impossible to eat or drink stuff you spill everything, so I got this. I don't know if it's actually gonna be good because like the lumen is very small. It has to be very viscous to actually do anything. It basically has to be like water. And if it's like super smoothie, I don't think I'll be able to eat a smoothie through this. You know, I should really get just like a funnel. That's what I really need. I'll stop by the dollar store, put a funnel in my mouth, and just start funneling food into my face. But yeah, I don't know. I'm gonna stay here to recover afterwards, and my mom might stay over for a day or two. I'm staying in the hospital for a day. I still don't know what time the surgery is. I have to call the office later, my surgeon's office. And yeah, today's not the worst day. I mean, I still took a bath at 3 a.m. like has been becoming usual, but I went to sleep back afterwards. Actually, no, the bath was taken at like 5 a.m. I think today, and I slept back from 7 to 9:30 or something like that. So a little bit better sleep today. I'm gonna go to the gym right now. So it's sunny, so I'm hopeful for things. Things are looking up. My roommate described how when he was getting his nose job after breaking his nose, the doctor asked if they wanted to move his tongue forward or his chin forward, and that it would affect his posture. And he was just like, "No, that's okay." But like, when he shared that, we just kind of like, "That's so weird. Like, how is moving your tongue forward gonna change your posture?" But then, I was thinking about it, and then I looked up that article about the association between the anterior head position and OSA severity, and I'm like, that makes kind of sense. If you're able to breathe with your head up straight, you'll be able to keep your head up straight more. My resting posture won't be so like hunched over, like Quasimodo. I don't think I could find anything using the anterior head position as a diagnostic measure, though. There's just the association. It'd be kind of interesting to see, do all OSA patients have the anterior head position? What proportion? What false sensitivity and specificity? So that's a good clinical pearl right there. So it's June 21, so 5-6 days before surgery, and the last few weeks have been real difficult. Really getting into the routine of waking up 3 a.m. and taking a bath in the morning, and maybe if I'm lucky falling asleep after, but my functionality's really gone to shit. Walks if I'm lucky, but I haven't been to the gym in a while. I'm not able to do much. Trying to do some video editing, and that's been a little bit okay, but it's difficult. So it's really culminating. So it's the surgery's come at the perfect time. So I got a call from a nurse yesterday about just preparations and procedures, stuff like that. What to take, what not to take, how it's gonna be. Like they said, I'm booked in for like a day after the surgery. Just make sure I'm okay, and maybe we'll see how it goes. Might need longer, but I'll probably it's on Monday, and I'll probably get discharged the day after in the morning, Tuesday, 8 to 11 usually, if things go well. And I have to call my surgeon's office on Friday after 2 p.m. because they just make the day's schedule the day before, so I don't actually know what time I have to get there. I have to get booked in Um, I'm not sure how long it's gonna take. As per my surgeon, I've been told a few different things. The fourth surgeon says he takes like 2 hours, and sometimes online I can see it says yeah, it's like a 6-hour surgery, and I'm like, yeah, right. And it's apparently the last day of school at this high school here. And they're getting donuts. Man, I'm jealous. What was I saying? Yeah, so I'm excited. Like, I'm gonna wake up with a completely new face. One video I saw says that like as soon as the person woke up, they could tell that things were different. There was just so much room to breathe, and it felt really good. The breathing was improved immediately after, and then the swelling happens and everything goes to shit. I'm getting a new roommate coming in on the 29th. I thought he was going to come on the 25th, a couple days before the surgery, so I can invite him. But he's coming on the 29th, and he's bringing a friend to stay over for a couple days. They're going on a road trip, so that should be interesting. And initially the plan was to stay at my parents' house afterwards, have my mom look after me, but I just don't feel comfortable there. And I just really like the home I built or I made, and I'd feel more comfortable there. So I just said like maybe like if I need you, like I told my mom, if I need you, you can just drive over. Or she's thinking of bringing a mattress over, and there was a bit of contention there. I kind of pissed her off, but I'm like, I'm not gonna go to your place. Like, I don't feel comfortable there, so I have to do what's right for me. And yeah, so the swelling usually gets bad, I think, day 2 to 3 after the surgery. So the day the new roommate moves in, I'll have like a head like a watermelon. So that'll be a great first impression. And I told him like I'm getting this done, and he's like, oh yeah, I heard about that. But hearing about it and then living it is a whole different thing. So yeah, crazy life, crazy things in life. I'm trying to free up some space on my phone to take videos of the recovery, the surgery, the day of, and recovery process. But my phone is so gimpy, it's like I can't transfer the photos or videos over the USB onto the computer. It's giving me a bunch of issues. And I have to they're making me get typed for my blood in case I need a transfusion. And like I can't do that at the Life Labs like near my house. I have to go all the way to VGH to do it, like an hour and a half drive or something like that. So that's frustrating, and I have to do it in the next like 2-3 days because that's the window I have. That's the time. And then I'm getting a call from an anesthesiologist regarding things, because specifically I have OSA, and the breathing while I'm passed out can be a bit difficult or tricky. And I've decided like I'm not gonna tell him to be more conservative with the advancement. I'm gonna stick with the goals that I mentioned last time, the aggressive focus on advancement to hopefully get cured, increase the likelihood as far as possible, because I'm just motivated by the desperation that I've been feeling lately, and that's fine. And also to do the chin as well. Hey, so I just got my surgery time for Monday on the 27th at 6 a.m. So I'm like, oh, that's so early. But then I'm probably like, oh, I'll probably just wake up normally. I'd just never go back to sleep, take a bath at 3 a.m. and like normal.
Yeah, kind of nervous and restless. The office gave me the surgeon's number, emergency number, and like at first I was gonna ask him like what is his surgical planning like? What is uh what is his process? What is his plan for the procedure? I just wanted to confirm like just obsessing, just confirm like like how his approach is, if he's like if he does much planning at all, or if is he just like a analog guy and just really nervous about it. Like I was reading online on a forums like, oh yeah, some surgeons just advance everything and hope for the best, whereas others like plan things more detailed and make are more like consider the patient's anatomy more. So I don't know. I think just even advancing it would be fine. I'm just getting scared for no reason. Like I saw uh, uh, on YouTube, like a bunch of people doing it, and like they don't have any troubles. They do it, and it's fine. Uh, what else was I gonna say? Oh yeah, the anesthesiologist said that like I'll wake up a few minutes, like 5 minutes after like the procedure's over or whatever, and like I might be in a recovery room where not many people will be, and I'll just be like, I just can't imagine what it's gonna be like afterwards, just waking up after something like that's done. I remember waking up from my wisdom teeth extraction, and I was just kind of confused, and I don't know. It's scary but exciting. I'm just really nervous about if the surgery doesn't work. Oh my gosh. I'm just so nervous. I feel like I have a really fat tongue, right? And like if I protrude my mandible forward, like it could probably move forward a centimeter, right? Which is similar to the MMA. That's just a centimeter here and then here. It's a centimeter. But if I relax my tongue when it's forward, my tongue is like still gonna. It's gonna obstruct me. My tongue is just too fat. I was like, mm. Even a centimeter forward, like it'll be better, but it'll still be. But I'll be able to move it forward, and there'll be a centimeter on top of the moving forward. So I guess that's good. I don't even. I have to accept the possibility of not being cured. It better be a success if it's not a cure, I swear. Jeez. I already have a rap song written about. I already have the rap song written. I wrote the rap song like a month or two ago. It's called Mr. New Airways. It's about it's Bubba Sparks, Mrs. New Booty. It's a spoof on that. So instead of booty, 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 booty rocking everywhere, it'll be breathing, 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 breathing all night long. Breathing all night long, breathing all night long. I'm down with you, Mr. New Airways. Oh, there's a line in the song that goes, not medically dependent on positive pressure. MMA first line, it's a total cure. So it would really suck if I had to change, it's a total cure to it's for sure or something. What would I change it to? I don't know. I like the lyrics the way they are. I really don't want to get my heart broken.
Hey, it's June 26th, the day before the surgery. Um, I didn't sleep too bad last night, although it's been really bad lately. Um, I went for a little walk and I talked with a friend on the phone. And I'm at the community center right now. I was going to go to the gym, but I'm just too tired. I'm just gonna go home. But there's stuff I have to do. I have to pay property tax. That's due July 4th, I think. And I don't know if I'll be able to do that when I'm after the surgery. And the library doesn't open until 1. So they're a couple hours, so I need to use their computer to go on the internet. And I don't own a computer at home. My phone doesn't is kind of broken. Uh, And then I have to renew my license to practice for my job and document all my continuing education credits. And like I haven't done enough of that, and my brain doesn't work, so it's not very accessible. And it's the day before, so it's not going to happen. I have until the end of July for that one, so hopefully I'll be able to get that done. But I think they make exceptions for medical reasons. Uh, Uh, yeah, I mean, like as you can tell from most recent videos, just oscillating back and forth between fear and desperation, anxiety and stress. I think that's fine. Um, I'm just like with the epiglottis and the worry that my tongue's so big, it's not gonna be effective. It's not gonna be effective. What's gonna happen? Like I'm gonna look disfigured. Uh, like I'm just reminded of the Serenity Prayer a little bit. I've been thinking about that. I had a little bit of a spiritual crisis, like wanting to like stick my middle finger up at the world and God, like putting me in this situation. But one of Brother Ali's songs, he says, "You've been trying to build me up my whole life," and I'm like, I'm here. I'm doing this, and it's what I need, and I'll be grateful after it's done. Keeping faith, and reciting the Serenity Prayer. Grant me the serenity to accept the things I can't change, courage to change the things I can, and the wisdom to know the difference. So all these different things that I was thinking of asking the surgeon, or just trying to control everything and worry about everything and learn everything. It's not really gonna, I don't know, it's not gonna give me what I need, kind of. It's not gonna make things okay. Like, it's not in my control. And yeah, just have to let go, have faith. And my allergies are so bad. I'm at a park nearby again, still June 26th, the day before surgery. I don't really know what to say. There's not much to say, I guess. I feel like maybe I'm making too much of a big deal out of it. I see some YouTube videos where like these teenage girls go in and they're more worried about like what skin product to wear before the surgery than actually getting to have their face cut off. I guess maybe it's just because I work in healthcare, and I don't know, maybe I'm just more anxious. I know all the things that can go wrong. I'm just checking in, sitting on a nice bench in a park near a tree in the shade. It's hot out, and allergies are bad. I feel like I'm gonna go sneeze again. looking at some nice water. The path is closed because the level is so high. Just enjoying being here and not feeling completely horrible. It's July 26th, the night before the surgery. My mom is gonna pick me up at 4:30 a.m. tomorrow. We're gonna drive an hour to the hospital. We have to be there at 6, and I'm just having a moment right now. I'm just really scared. I opened up my phone and started reading some articles I saved, and they're talking about the genioplasty. If you sever some muscles, it can cause some complications. This is crazy. This is crazy. It's crazy. It's the day of. We're on our way to the hospital. It's 4:50 a.m. I didn't sleep. I slept okay last night, or as okay as usual. Took a bath at 3. I got all my stuff. I'm bringing a little notebook. I don't know why. Maybe if I want to write or something. I'm bringing a book and just my wallet, my phone charger, and a little rock that says courage. It looks like it's upside down, maybe. And my keys. And I got my CPAP. I don't know if there's anything else. I think that's everything.
One-way street.
Yeah, I'm really scared, and I don't know. I always thought that I didn't think I was brave doing this. I was more desperate. I'm like, oh God. But now, because I'm just feeling so scared, I'm feeling a little bit brave because I'm doing it anyways. So we're going.